Pediatric Oncology in Lyon, meeting staff and sick children. The Commission aims to stimulate job growth in the health sector in developing countries with the hope it will improve the country's economy too. The World Health Organization says by 2030 there will be a shortfall of around 18 million healthcare workers in middle to low income nations because of the growing and aging of populations. President Zuma and Hollande will co-chair a second meeting of the Commission in New York in September before publishing a report by the end of this year. And for the latest developments on that commission, we're now joined on the line from France by our correspondent, Dan Whitehead. Dan, a very good afternoon to an interesting commission scheduled. Have the formalities started? Tell us more.
Yes, absolutely. In the last hour or so, Alicia, we have begun formal opening, I suppose, of this commission here in Lyon. But this morning, as you mentioned, was really the pictures of this story. President Zuma and President Hollande visiting children, sick children, and the staff caring for them at the I Hope hospital in the centre of Lyon. Really the front line of what this whole story is about, which is about creating millions of new healthcare jobs around the world, and particularly in developing nations, ensuring that not only that the health needs of people are catered for, but actually understanding that those developing countries, by creating those jobs, can benefit their economy as well. But yes, the Commission underway here. There are talks taking place from a number of executives from the World Health Organization, from other health bodies, from civil society groups, from representatives of other governments around the world. They're all having their say here at the Commission. There won't be any outcome as such. They will be meeting again in New York in September before publishing their findings.
Look, Dan, I know you've just mentioned now the Commission is to be focusing on the creation of healthcare jobs, but how exactly is this going to work, specifically looking at South Africa, where skills shortage in the health sector is still high?
Yeah, absolutely. In terms of how, the focus is really on determining financial sources. That could come from private investments, it could come from government pledges, to invest money into the health and social sector employment. They are talking about generating the political commitment behind that, and also analysing the risks of global imbalances of unequal distribution of health workers. And that really stems from this brain drain situation, which many of the officials have been talking about here. And you see that, especially here in the UK. We will see South African doctors and nurses working here. We will see doctors and nurses from Asia and from the Middle East working in, for instance, in the UK. However, the concern is that actually they want to encourage those workers who are trained in developing nations to stay there and to provide the facilities back there, because there is a concern that actually developing nations are subsidizing developed nations when it comes to healthcare, which really addresses the imbalance and inequality over this situation.
Look, Dan, the issue of private versus public health care is always a big issue, but give us the scope. We hear that President Jacob Zuma will be meeting the French President François Hollande on the sidelines of the Commission. Do you think they might go into discussion about this?
Oh, absolutely. It will be a bilateral meeting on the side of this meeting today, and they will be holding meetings to discuss more widely the trade links, of course, between the two countries. France still wants to be heavily involved within South Africa, and Jacob Zuma, of course, keen to stress the stability of South Africa's economy, given some of the headlines which you've seen over the last 6 months or so. So they will be discussing those issues. And of course, when it comes to this commission specifically, both South Africa and France will be keen to see that their companies, whether it's technology, whether it's education and training, healthcare facilities, are involved worldwide in contracts which may well be dished out because of this, and certainly they will be put forward to be considered equally. And so there is a trade benefits for both countries here when they're looking at the real solutions to solving what the World Health Organization say is a crisis, and that by 2030 in developing nations, 18 million will be the shortfall in healthcare staff.
Dan, very quickly, look, with so many countries involved, I'm curious to know the outcomes of the Commission. Just exactly how many countries are we looking at? And of course, how will those resolutions be affected thereafter?
Well, in terms of the countries that this could impact upon, it's the entire United Nations. So a large number of countries, and it isn't just developing nations, although the focus is on that. It's also developed nations as well and how they can work together. In terms of outcomes, as I say, they will be meeting again, both presidents co-chairing a second meeting in New York on the sidelines of the UN General Assembly in September. They will publish their report by the end of this year.
Thank you so much for that update, Dan Whitehead, live to us from France.